Friends, and thank you for tuning into the Optimal Health program today. Hope you're all doing well. Hope you have your pen and your pad ready to take some interesting notes. A lot of great research coming out of a variety of great journals, as I've done for many years. I do all the time. Just get on the computer or my iPad and look for interesting stuff. Those individuals who are taking antidepressants, and this comes from a variety of different studies, may have a significant increase in cognitive decline or dementia. And this is something that has been talked about for a while. I think a lot of family members start to see their loved ones over time start to change and lose that sharpness or that focus when they're on a variety of these medications. One study was over 19,000 people diagnosed with dementia. 23% of them were on antidepressants. And the cognitive decline was worse in those that took the antidepressants compared to those who didn't. So it can affect a variety of, brain chemicals and neurotransmitters. And as we get older, neurotransmitters are dropping anyway because we're losing cells in the brain. So that's not advantageous in many cases. 65 and older were the population in the study. And they say that the depression is also common in those, 50% of those who take the medication. So we have to look at better ways to improve brain function. And my approach typically looks at the nutritional realm, looking at diet, vitamins, minerals, looking at hormones, of course, because hormones are chemical messengers that allow your cells and your organs to work well. And if they're not working well, you have to correct them. And when we see people that are correcting testosterone, DHEA, estrogen, progesterone, all bioidentical plant extract, of course, even IGF-1, which is the active mechanism of growth hormone, you start to see great mood, memory, focus, concentration. Your body will feel better. And if you do some exercise, you'll burn fat and sugar better. So that also adds on to a good mood. Your muscles will do well with exercise. So it's just putting back in place all of these things that your body had years before, where you were doing extremely well in that, consideration. So rather than just go on meds, and be taking 10 pills for all sorts of things that are going to interact with each other sooner or later, it's better to find more significant underlying cause and correct accordingly. Phone lines are open if you'd like to call us, 888-420-9272, 888-420-9272. Of course, we're thanking all of our wonderful Rumble, TikTok, Instagram, YouTube followers, Reddit, and, of course, Live from America friends. I'm not good with abbreviations. There are too many medical abbreviations that we have to know, so LFA, Live from America. Got it right this time with Frank's help. We're going to talk about a bunch of new things we're doing in the office. So I've done telehealth for a long time where we call patients and go over their history. I'm on my iPad and it takes our conversation, puts it into a perfect medical note, Within the iPad, I have the electronic medical record, so I have templates for each visit and all the different things that we do. And AI, Freed AI, which is a medical company, allows us to take our conversation, I don't have to write or type because I'm horrible at both, and put that into the perfect medical note. So with telemedicine, you could be in your home. We can evaluate you, talk about the things that are important to you, your problems. Based upon that, we can create a mechanism where we can send a lab to your home to get your blood drawn and then review that over the course of about 5 days to a week later and start to create a program for you. Part of that program, and this is a big part of what we do for all of my patients, is going to be vitamin recommendations, because we're testing your vitamins and we're looking at your medical condition to be able to make the perfect recommendation for vitamins, custom recommendations tailored to you, much more important than randomly just taking a bunch of things where you'd buy bottles in a store. So my newest idea is that we're going to make custom vitamin packs for you. So if you have cardiac issues, and we're giving you a morning and an evening pack that will have specific vitamins based on your blood test, based on your condition. You might be taking more CoQ10 because of your cardiac history, or more magnesium to help with your blood pressure. So you might take 2 multi in the morning, 2 in the evening pack, 1 or 2 CoQ10 morning, evening, vitamin C, vitamin D and K, and I can put a variety of different things into those packs to be specific to your condition. So we're doing this both for existing patients, and we have another large telehealth mechanism that we're bringing on board from 2 separate companies. One lovely lady and her associates work with some private nursing for a lot of Medicare patients, so we're going to be able to help them. And some people that can't get out of the house, we'll be able to connect with them to do the telehealth. Another large company that has contracts with large organizations that have lots of Medicare patients at home, in skilled facilities, etc. We can do the telehealth and then put patients on remote patient monitoring, where we can have a watch that a person would wear that would check their vitals and look at their blood pressure, their pulse, their oxygen, blood pressure cuff, etc. And all this data is gathered so that you're being monitored. And if we need, we could intercede and be able to, create some good result rather than a person starting to get ill and go bad and end up having to be rushed to an emergency room. So the idea of monitoring you and keeping your body healthy, whether it's vitamins, minerals, hormones, medication, etc., is a terrific, terrific concept. So we're working on that diligently. We'll also do a vitamin consult where people that can't get to the office and they may live far away or out of state can do the same telehealth mechanism where we take your history, go over everything, send a prescription to you if you're out of state, get your testing back, review that, and then put together vitamins for the vitamin recommendation, the custom vitamin pack. So we have a lot of wonderful things on board. Okay, any calls or questions?
We do have a question regarding regarding the vitamin packs.
Mm-hmm.
It says, "Hey doc, I'm tracking things like energy levels, mood, or even digestion every day. Can that data help you tweak my vitamin pack?"
Yeah, every bit of information, and I say this to everybody, every bit of information you give me enables me to have a really thorough understanding of what your body's doing. So, and I tell all patients to do this when I see them in consult. We'll give them a symptom checklist where they can write their symptoms down in the left column of a page and then write how they're doing week to week. We give them a weekly diet report so they can write down on this weekly chart what they're having: breakfast, lunch, dinner, snacks. They could also write down symptoms and issues, benefits or drawbacks or whatever they're going through. So the more information you give me, the better. So for sake of discussion, if we put you on some vitamins and you have far better energy, or you're sleeping better, or your color vision improves, or for giving you a methyl B12 shot and you can give yourself the shot at home and we can set that up for you, teach you how to do it. If that gives you energy and then we see your blood work is better, absolutely. This is everything we want to do, gathers as much information from you as possible. So this is what we've done for all patients always. This is just, further extension by doing it, via telehealth, telemedicine. So yeah, absolutely.
And then another follow-up. How often do you actually update someone's custom pack? Every month? Every time the data changes? How responsive?
Great question. So that depends upon how people present. Of course, if your D is low, or C or E or beta carotene or any of these things, and we make the recommendation to correct that. And again, taking into account your medical condition, some people may not methylate B12 or folate. We have a methyl B12 folate supplement to use, and we may use the B12 shot. We'll recheck your blood for those initial abnormalities within about a month of being on the nutrients, 3 weeks to a month. And if your levels are great, perfect, then we know we've created that improvement. If a person says, oh, I'm a little bit tired lately, and we correlate and we find out why, we could adjust. So I could always adjust. I could adjust it at any point. So the pack is going to be a box with your name on it, some handouts about the specific combinations of nutrients and things. And if it's done initially for 1 month and we recheck you, if we have to adjust, then you get a new recommendation. If your numbers are great within that month, then we may keep it the same, and some people may opt to buy 2 or 3 months worth. So, yeah, it's going to be roughly maybe a monthly recheck to make sure you're in the right zone.
And then another one from Rumble. I've always wondered if I'm just peeing out most of the vitamins I take. Are you able to show if my body's actually absorbing what I need?
Absolutely, positively, without a doubt. So absorption means getting it into your bloodstream. So if you're taking vitamin D drops under your tongue, for example, because I see this a lot, usually people don't have great vitamin D levels by taking those drops. You would think that a liquid under your tongue would be better absorbed, and in many cases it could be or should be, but maybe the strength of those drops are too weak. So the question would be, if we give you a different vitamin D, a capsule, a gummy, whatever, and then we can see that your levels are better or higher, great. We know that now from this new recommendation, you've got the absorption and you have it in your bloodstream where it gets delivered to your entire body. For vitamin D also, for example, for some people that are very low, we may give them a vitamin D shot, which is oil-based, time-released, so it lasts about 3 to 4 weeks. So we may do the shot, give them the oral vitamin D, check them, their levels come up to the perfect range. So yeah, that's how we do it. I hit upon the methylation issue. There are some people that don't have a gene that you would use to convert regular B12, hydroxycobalamin or cyanocobalamin, into methylcobalamin, which is the only active component, like having a key to get into a door. You don't have the key, you're not going to get anywhere. But using that methyl formula will help, and also take in the methyl B12 or folate shot, because you're getting the already converted usable form. So there are a lot of little nuances that occur within, testing, recommending, and then, evaluating to see what is working. So yeah, we do that all the time. Okay. On every patient I've ever seen in 37 years.
There we go. Another one from YouTube. I'm taking prenatal vitamins and currently trying. Can I still get B12 and vitamin D shots?
Absolutely. We want to keep your vitamins in that perfect range. So the nutrients in that perfect range will help your body in a wide range of different ways, for many ways. So we do that for a lot of women, because when they come in and they're anticipating getting pregnant, if we look at their levels and they're low, we just boost those up. And that, again, there's no more perfect way anywhere, anyhow, than to look at your blood test and know your medical concerns and condition and make your vitamins specific to that. So it just makes it super easy when I myself take the recipe sheet and put, a couple of this, a couple of that in the morning pack, a few of these in the evening pack, a few more of the nutrients. We may have some side nutrients that we wouldn't put into the pack, powders like maybe collagen peptides. We'll talk about good organic protein powders that people can use, etc. So we talk about all of that. But I think the pack is a very simple way to do it, and it couldn't be better. It couldn't be more tailored to your body, because we take everything into consideration when we do our initial testing.
Okay, another follow-up. With all the different forms, magnesium citrate, glycinate, oxide, how do you choose the right one? Is it something people should be taking daily? Usually
we recommend combination of the different types of magnesium. Same thing with calcium, because one person may not absorb one type as well as another. So that varies. So to take a formula that's got a few of them in it is better than just taking one.
All right. Another one from YouTube. This sounds a lot like precision medicine. Is this where healthcare is headed? Real-time data, custom vitamins, no more guessing.
Yeah, thank you for the term. I may have to use it. Yeah, so I've always done the vitamin recommendations specific to the blood work and the condition, but making the packs is so much easier than a person going out and getting lots of different bottles. So as I do with hormone replacement for estrogen, progesterone, testosterone, bioidenticals, IGF-1, peptides, all of this is done based upon specific testing, recommending, and then retesting. So yeah, this is as precision as you can possibly get. And I've always done that, but the new mechanism of using the pack just takes all the confusion and the difficulty out of it. And as I say, in the person before that asked the question, how often might you adjust the pack? Well, your body has to tell us. And I say that to every patient every day. Your body has to tell us. So if you're doing a lot of exercise now, you weren't doing it before, and you're burning up your vitamins and minerals faster, you're using them up with your physical exercise, we may have to raise certain things. So it's going to be the perfect way to look at your body's requirements and needs, start to correct, and then just make sure that we're hitting the nail right on the head. So in essence, absolutely, it's the most specific, thorough, individualized, tailored, perfected way to correct and maximize your health or your fitness.
And another one from Rumble. I'm perimenopausal. Perimenopausal, and my energy, sleep, and mood are all over the place. Can your monitoring catch hormonal shifts and adjust things like that?
So yeah, the first part of the picture is when you're looking at our big blood test, which is about 20, 25 pages, depending upon what we're looking at. So those individuals that are perimenopausal, they could be in their 40s, 50s, 60s, et cetera. Usually, obviously, it's younger because they haven't gone through full-blown menopause, but some women don't finish until they're a little bit older. But looking at a few components, estrogen, progesterone, all the different types of estrogen, there are 3 types, and looking at FSH, LH, when you start to drop your production of hormones from your organs, your glands, your ovaries, your estrogen, progesterone decrease, and FSH and LH go up. When the FSH and LH are going up a little bit, you're early into it. But when the FSH and LH are high, close to 100, you're in it. You're full blown. So that the elevation of those 2 blood tests and the decline of the others tells us exactly where you are. So the recommendation could be made to give you a little bit of the bioidentical estrogen, progesterone, either capsule or cream. For women, we also use testosterone because you need that to protect your bones, to have good muscle response to exercise and activity, to have good sexual response. So we're looking at correcting all the hormones that have changed, not just one. And certainly thyroid's in there, IGF-1, the active component of growth hormone, that's also part of that. And then make a recommendation, and a few weeks later, 3 weeks later, we'll recheck. If you tell me symptomatically and functionally you're doing better, that's great. But also your blood test says, oh look, your FSH was 95, now it's at 40, and your estradiol levels right in the middle of the perfect range. So we're looking at all of these things to put you into that perfect zone.
And another Rumbler asking, hey doc, are these kits and tracking systems safe or useful for teens and college kids? I've got a
Absolutely.
17-year-old who runs track and never eats right.
Absolutely. So why do we eat the best foods? To get the nutrients, the good proteins, and all the great things from good foods. You can't get all your vitamins from food because you can't get the levels that you'd need to protect your body, especially for someone who's young and very active. They would need higher vitamin recommendations because they're using them up with their activity. Just like a person who's much older that's not absorbing well, you have to give her higher levels. And when you do, if they absorb 30% of a higher number is better than 30% of a lower number. But absolutely, it's the perfect way to do this for young population, teens, everyone throughout the spectrum. And of course, athletes, you may want to check them a little bit more often because they're going to burn through these things. I have pro athletes, that are patients of mine, friends, a great linebacker from the Bears, very good friend of mine. Hopefully I'll see him tomorrow. Another great friend of mine who's a pitcher for the Yankees, a pro bodybuilder that one Mr. Olympia. So I have a lot of different people. And if you look at my patient population, it's everybody from every walk of life, which for me is cool because you get to talk to people about all sorts of different things. What's their life like, how they grew up, everything about them, which, intellectually is interesting for me. So we test and correct and retest and perfect all of these things based upon those tests.
And on YouTube, we got a question on hearing about magnesium lately, especially for sleep and stress. I've seen TikToks about it. How do I know if I'm deficient, and is there a certain type
Good
that
question.
actually works
The
best?
best blood test for magnesium is a red blood cell magnesium test. So there's a serum magnesium, but that may be in the normal range, but you would need more to fill up your red blood cells so the red blood cell is more accurate. And yeah, there are lots of things out there, and I appreciate, your comments now because that's the most important step. People look at YouTube and Instagram and all these places, and they see something, they run out and they grab something and they say, well, this didn't work, but you're not being scientific about it if you do it that way. So once you see something, rather than act upon that, call somebody who does this every single day, for a living and as a specialty, then we can test and see what your levels are and then make recommendation and correct that. Yes, magnesium is good for sleep. Magnesium is good for bowel function and allowing people to have an easier, better movement. It's also really good for blood pressure because around the blood vessel, and here's my handy dandy blood vessel model. If you can see the dark color in here, if we can zoom in, this darkish color are the smooth muscle around the blood vessels. When they're tight, the blood vessel is narrowed, which could raise pressure. When they're relaxed, there's less pressure. So for people that have high blood pressure, if they're low in magnesium in the red blood cell, and we give them the magnesium and we start to see their blood pressure correct, that's a wonderful thing. If the same thing occurs in your airways for your lungs, so just as your blood vessels, your airways have smooth muscle around them, and when the airways are tight, you can't breathe well, can't get the air in. But when the magnesium deficiency is corrected, you start to see people are breathing better. So these are just examples of, how important magnesium is in every part of your body.
And a Redditor joining in. Hey, Doc, I have gut issues. Some vitamins don't absorb well for me. Does your plan take that into account with different forms of delivery systems?
Sure. We look at a variety of things, including gut function, because the gut's the doorway into your body. So there are labs that will do these great stool tests, microbiome tests. Some of them had been shifted out of New York because New York had been difficult with some of these tests. But Genova Diagnostics is a good company, and there are tests that, New York allows them to do. So those are easy tests to look at. And again, there are some people who do well with vitamin shots. And for some, we do vitamin IVs because a vitamin C IV has got a gigantic dose of vitamin C in it. This has been around forever. And vitamin C IVs, if you look it up on Google Scholar, which is my favorite search engine because it's easy, on vitamin C intravenous therapy, putting that in the search engine in Google Scholar, you'll get 1,400,000, 500,000, 600,000 studies showing how it helps to inhibit cancer, inhibit or knock down viruses, Epstein-Barr, shingles, even COVID, but the literature's there. So there are different ways that we may do some of the therapies depending upon the individual.
All right. You've answered all of them thus far, but I'm sure they're going to come in.
Good stuff. Reiterating on the monitoring mechanism, I love the idea, especially for people who are ill and Medicare patients that you can't really get back and forth to the doctor. Every day that I see patients, we talk to them about this or that. Many of them have a specialist, a cardiologist, a pulmonologist, an endocrinologist, an ENT, just like anybody would. You can talk to 1,000 people. Everybody typically has seen different doctors, a GI doctor. But lately, because of all these big entities buying doctors, private practices and putting them into this big mechanism, people can't get to see the doctor. And I hear it every single day. Oh, I made my appointment for my cardiologist. It's 3 months out. I'm like, 3 months? But you're having an issue now. Fortunately for my patients, I have a wonderful connection with St. Francis Hospital. The doctor's there. One of my favorite doctors, and I want to interview him on the podcast if I can ever get him free for a little bit of time.
Busy man.
Because he is the busiest doctor I've ever seen, Dr. Richard Schlafmitz, the best cardiologist that I know. I've had most of my patients with cardiac issues see him, my parents, everybody. I think he's the best. And I can call him or text him. He wears his phone around his neck even when he's doing catheterizations and such. And I can say, I've got a big issue with a patient. I'm going to have them call your office, etc. He'll, oh, don't worry, take care of it. He deals with dire circumstances that you or I or anybody else might get upset about, but he's cool as a cucumber. And I tell this story all the time. It's my favorite story about him, one of many. I had a patient in the Plainview office a few years ago that had a really bad aortic valve. And you could hear the murmur without the stethoscope. So that means that the valve is so bad that that person, may die over the course of a few days. And the patient could barely walk into the office, short of breath. So I listened to the valve. I said, this thing is barely working. It was just a bad scenario. So I stepped out of the room and called him and said, hey, Rich, this guy's bad. This valve is bad. It's got to be done as soon as possible. He goes, okay, no problem. Don't worry about it. I said, really? He goes, yeah. We'll come pick him up. We'll get him done this afternoon. Getting to see a team that can do that, doesn't happen in a half hour or an hour. I'm telling you, in a half hour, that ambulance was here, picked him up, brought him back. And I think that was like 10 o'clock in the morning. By 1 o'clock, the procedure was done. And Rich will always text or call and say, yeah, everything went well. He's fine. He's good. Very just calm and matter of fact. And here I am sitting worrying that this is going to go south or turn bad. You never know when things are going to turn south. And sometimes they do right away. But, done easy like it was nothing.
That's unbelievable.
Yeah, it's spectacular. So, yeah, he's one of my favorite doctors of all. So if you can't get to your doctor, sometimes you can get in by going somewhere else or, looking at some of the connections. But it doesn't make sense to me that these doctors of all specialties, patients can't get in to see them.
Yeah, the chat's just going off about,
I don't get it.
They have to go to the ER to just be seen because they're
right, and
primaries.
that's no fun.
Yeah.
And I've had lots of people that have called, I'm in the ER, or I did this and that, or something happened, and they're in the ER for hours or days, and they're trying to get the testing done. It's just, and you need hospitals and ERs. It's just, I don't know how to be able to help the situation or fix it. Well, in saying that, reminds me of, for these patients that we will do the telehealth and remote patient monitoring, we're going to track them. And I'm going to have staff, a couple of, and then a bunch of PAs to be able to do this and monitor this and be able to get on the phone with, 100 patients a week and et cetera, because there are many thousands of patients that need to have this. We're going to track them. We're going to have a tracking of their pulse, of their oxygen, their heart rate, their respiration, if they start to fall or have issues with that, this watch and device will send us information that we obviously will also send at the same time to their primary care. So if we could intervene and help to prevent something from happening, you're saving those big ER visits, So I think a lot of medicine in the future will go to this realm for those individuals because you want to keep them safe and strong and prevent them from having these bigger episodes. So it's sort of like, I don't want to say concierge, but it's having something there available all the time to track you so that you could contact our office and we could contact you and just contact your doctor, your primary care, your specialist, and kind of get it covered. I wish there was a better way to describe it, but, we'll have you covered.
I think you did a pretty good job. It's incredible.
So very excited about it.
So I just have a question from Reddit. If I stay on your system for a year or more, will I have access to like a full health history or dashboard showing how my levels have improved?
Well, yeah, you get copies of the blood work all the time from us. So when I see a patient, take their history, examine them, get the blood work done. Within 5 days, the blood work's back. Go over it with them, either in office or online. You get copies of all your blood work. if we do cardiac testing, which we do in the office, an outside company comes in, big cardiology group, the techs come in, do the carotid, echo, lower extremity, all the different sonograms, lower extremity, arterial testing. Those tests, patients get a copy of. So all of that, allergy testing, all of that.
I think this is a joke on Rumble, but they want to know if it's going to yell at me if I sit at my desk for too long. Tells me to get up.
Wait, we can work something in that. Yeah, maybe we'll shock people.
Yeah, you may have to sign something off.
I've got to call this company and see if we can get like a little buzzer that'll shock people. Exercise, exercise. Sitting too long, sitting too long.
Too much carbs.
Good comment, good question. Wow, I got to see if we can work that in there.
We got another one. I've been taking supplements for brain health, omega-3s, B12, nootropics, but it's all guesswork. Can your data actually show if my brain's benefiting?
Yeah, we have a machine that is a funny-looking cap you wear in your head. It's either red or blue. It's got a whole bunch of little holes in it that will put a little gel and put these electrode monitors that read your brain waves. It goes from the cap, to a computer, and you're on the computer and you're answering questions and you're supposed to answer things or click on, the buttons quickly to just see your brain speed and your brain function. And this can gauge us as to how well your brain is doing. Although I can tell you that although there are certain supplements that are described as being beneficial for your brain, like fish oil, yeah. You've always heard, though, eating fish, it's brain food. It may or may not help. You may have other things that you need to repair and improve your function. NAD, nicotine adenine dinucleotide, is an amazing substance that your body had tons of between birth and, I don't know how long people make a lot of it. Probably people decline in their 30s and 40s, because we see a lot of people that say they have brain fog and they're just not sharp or focused. Their mood's not good, that it can't get up and go. And when we show them the literature on NAD, which goes back at least to the 1930s and certainly before that, every science book and every science and chemistry book has NAD in the different cycles, Krebs cycles, and all of that cytochrome system. NAD is responsible for converting oxygen into 36 molecules of energy, ATP. So when we get people on the NAD and we give them little injections, we teach you how to do the little tiny injections with like a little 31 gauge insulin syringe. People start to say, wow, my memory, my focus, my concentration is great. My word retrieval is fast. My mood is great. I feel great when I exercise. So that would give you a bigger result than maybe just using fish oil or some of the other, you need the other nutrients. But the NAD probably will give you a far greater benefit to brain function than almost any other nutrient. I do like phosphatidylserine, phosphatidylcholine, methylated B, yes. But it's like a smorgasbord of things that you would need. But when you compare nutrients, which are meant to keep your body functioning well, and something like NAD or even the IGF-1, sermorelin, it's a very big difference. But our bodies are built that way. NAD is there for a reason. IGF-1 is there for a reason. Estrogen, progesterone, DHEA, testosterone is there for a reason. And once you walk back to where you had levels that were good, maybe 5, 10, or 15, 20 years ago, depending upon your age, when we start you, your body does better and better and better because you've always had these things. And you did well when you had good levels of these things. So that's fact. That's an absolute.
We got a Redditor. I don't want to be popping 12 pills a day. Does your platform help prioritize the essential nutrients based on real time, not just a full kitchen sink approach?
So if you were able to see what I've seen over 37 years, which is people coming in with shopping bags of different vitamin bottles, and I probably have that funny look on my face when the bag is full of individual bottles and people are taking 30 bottles worth and 40, 50 pills a day. And I tell them that's way beyond what you would ever really need. And we zoom in on using 5 or 6 things, maybe a 7th, depending upon their mechanism. And they're getting better nutrient density and their vitamin levels come up. It's just a world of difference when you fine tune and make everything specific compared to just going hog wild and buying everything that a salesperson or an advertisement tells you need to get. I'd rather use combinations of things as opposed to individuals, because there are some people buy individual E and D and B vitamins and K and C. I mean, they just buy everything individual, which is, exorbitantly expensive. Similar to what we do with allergy testing. And here's an interesting comment. Regions in the country have different trees, grasses, weeds, molds, whatever. But up here in the Northeast, rather than using 10 individual trees and a skin test for 10 trees, 10 grasses, 10 weeds or more, we can use tree mix, mold mix, grass mix. So you're covering all the things in the area and you're looking to see what you're reacting to. We can do the individuals as a little add-on just to see, but you're doing less skin testing, which people love, getting a little better coverage, which people love, and getting a better result in terms of treatment. So,
another question from Rumble. I'm on a plant-based diet, and I know I'm probably missing things. Are you able to pick up on like vegan-specific nutrient gaps and correct them?
Well, your nutrients are your nutrients. Everybody has the same need for all the Bs, vitamin C, D, blah, 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 those individuals that are vegetarian, vegan, typically are missing some of the Bs. And if you're not getting the Bs or any of the things, it'll show up in your blood. No person that I've seen walks in with perfect vitamin levels because they just don't know, what to take. And even the people that are savvy and hear about taking this or that, without the blood test before and after taking a supplementation, you just don't know where you're going. So our initial blood test tells us if what you're doing is working. In most cases, people are still low in D and C and CoQ10. People think that 100 milligrams of something is a big number. Certainly not for vitamin C. People think that 100 units is a big number for vitamin D. But realistically, all my patients take 5,000 units of vitamin D in the morning, and we test and prove they're in the perfect range. Vitamin C, some people will take 1,000, but then do 4 or 5 of them a day, which really works out well for most people. Some people go a little higher. Some people with difficulty with eliminating will go to bowel tolerance, where they'll take a good amount of vitamin C until they start to have a looser movement and then back down a little bit. So there are a lot of different ways to do it, but the blood test will tell us all that.
Question on probiotics. Is that a separate, it says, like I have gut issues, IBS or leaky gut. Does your vitamin pack come with probiotics?
Of course.
Or is that a separate?
So the best way to answer it is that the packs will always have a multi-vitamin C, probiotic, CoQ10. I may add other things to that pack and maybe use 3 or 4 CoQ10 a day for a cardiac patient, or more magnesium because a person's magnesium is low and they have high blood pressure, or more of this or more of that. So it's going to have the core of all the required vitamins, but we're going to add things depending upon that person's needs. So absolutely. Also, for people with gut problems, you have to skin test for allergy, because even blood testing for allergy may not show that you're reacting to a certain food or an environmental. And skin test may pick up something that you want to take out of your diet. So now you're taking away some of that inflammation, which will improve the gut. Bacteria, viruses also affect the gut. So there are different things to look at in our big blood test to make that change. We also have many patients with irritable bowel, Crohn's, colitis, where we've done stem cell therapy, which shuts down the inflammatory cascade. And on my website, there's a wonderful video of a gentleman who for 21 years was miserable and was afraid to drive more than a couple of blocks away from his house, afraid of having an accident. He ended up having an accident. We came in, did stem, and this has been 6 or 7 years. He's had no colitis symptoms at all. And he's doing brilliantly well from one treatment. So again, it depends upon what the causes are for your chronic condition.
And just a follow-up on Rumble, what's the difference between a probiotic and a prebiotic?
It's just different combinations of things that help to break down your food and help aid with digestion. Some people take a magnesium with pre and probiotic. I do that, and I take it at night before I go to bed. So I think it's good to help to stabilize your gut, enhances absorption, digestion, and that process where your foods and your digestive enzymes are in your gut throughout different points of the day in around the times that you're eating. So they're both very important.
What is the difference between arthritis from wear and tear and autoimmune related arthritis? Do they need to be treated differently?
Good question. So we talk about arthritis. It's simply inflammation of the joint. Inflammation can come from wear and tear. That's the most common type, where your knee hurts because grinding on the meniscus and stretching of the ligaments, the cruciates, the medial lateral collateral over time, and maybe with too much activity or playing, hardcore sports, you're damaging that soft tissue. There may be no bone change, but you're damaging the soft tissue in that joint. Over time, too much of that can start to have the bone change, or an accident can cause the bone to break or change. Or people can have disc problems in the back where grinding on the disc occurred for years, and now arthritis starts to overgrow on the spine, called osteophytes. Little pointy overgrowth of the bone start to occur. So there's soft tissue wear and tear, most common. There's arthritic change. Sometimes repetitive use or repetitive wear and tear and injury causes the bones to change. Obviously, you have autoimmune problems or mechanisms where your body's attacking your joint, like rheumatoid. There's infectious changes of the joint, like Lyme disease or other infections can inflame the joint and cause swelling and wear and tear. So they all have a slightly different mechanism. With wear and tear and damage and tears to ligament, tendon, cartilage, once we get an MRI and we see exactly what's there, we typically opt to do stem cell therapy because your own cells from your body put into that environment will go to where the damage is and become and weave in and become brand new cells of that damage and could create that repair. For people that have the autoimmune mechanism, there are many drugs that are used for those conditions, but they're not changing. They're just decreasing some of the inflammation or decreasing some of the potential symptom. And some of them are too harsh for people to take. We also do stem for the autoimmune mechanisms, lupus, rheumatoid, etc., MS. Even diabetes has autoimmune components. So that can shut down the inflammatory cascade as well as repair damaged tissue. For infection, of course, there's a pathway to use medication for that, but at the same time using vitamins or vitamin IVs to help to make your immune system strong to kill things. So some of them have a slightly different group of recommendations depending upon how people present.
All right, another one from YouTube. 52-year-old female with slightly high blood pressure and cholesterol. My doctor wants me to consider medication, but I'd love to try lifestyle changes first. Where do you recommend I start?
So all of the medical literature going back for many, many years, there's supposed to be a step care approach to treating hypertension. And the first part of the step care approach is to be lifestyle changes. Then the second part might be one type of medication, another type of medication, etc. For some reason, that first step has been just thrown away in the past 20, 30 years. What I recommend, and it depends upon how you present, if your blood pressure is 180 over 100, we'll put you on medication, but the same day, we'll talk about a low-carb diet, talk about walking every day, correcting vitamins, minerals, and hormones based upon your blood test. So when the blood comes back in 5 days, that second visit, we can go further into how to correct your vitamins, minerals, and hormones. If your blood pressure is not that high when you come in the initial, we'll do low-carb diet, 30 grams or below per day. So your body has a better ability to burn sugar, burn fat, which is great for your blood vessels, by the way. You want to burn sugar and fat away from causing plaque. Walking every day teaches your body to nice and quickly open up your blood vessels. So if I take any group of people, 10, 20, 30, 100 people, and you have varying amounts of overweight or blood pressure concerns, if we all start to walk every day, the activity of walking opens up your blood vessels to accept more blood from the activity to feed your muscles. You're delivering oxygen, vitamins, minerals, and hormones, all the great things to your cells. If you do exercise once and never do it again, you've not trained your body to quickly open your blood vessels. If you do it every day, your body says, okay, I understand. I need to be able to more quickly open up my blood vessels to accommodate the activity. And as you do it every day, and you're burning sugar because you're on a low-carb diet, you're burning fat on a low-carb diet, you have more energy, more focus, more concentration because of your vitamins and hormones. You feel good from the exercise, and your muscles feel great, and you have better endurance and stamina, and you're creating all of this over a relatively short period of time. Your blood vessel dilation will keep your blood pressure down in a greater zone. And for a lot of people, as they lose the weight and the exercise is there, we get them off medications because they don't need them anymore.
We have a follow-up from her, by the way. What is considered good blood pressure? I never know what the numbers mean when I go to the doctor.
So it's sad that doctors don't explain things, anymore. And I think years ago they used to do a better job of that. But the two numbers, the systolic blood pressure number, the top number, is a description of how much pressure you have to push to get that blood out of your heart. And the bottom number is how much pressure exerts back on your heart when you're filling it before it pumps again. That's diastolic. A great blood pressure, and you hear this all the time, 120/60. That's typically the most common discussed, great target for blood pressure, but usually the younger population has that. The only caveat or thing that I have to comment on is that as people get older and your blood vessels may be narrowed a bit, you may want to have a slightly higher blood pressure to perfuse your brain and your organs with oxygen, vitamins, minerals, hormones, and all the good stuff. So if you lower a person's blood pressure too low when they're older, they'll be tired and a little bit out of it. So you have to be careful when you're using blood pressure meds to control. You don't want to go too low. But yeah, we can look at people and say, hey, what was your blood pressure, years before? I was always this. Okay, let's walk our way back to that. Let's get the weight down, get the exercise done, and maintain a healthy, strong mechanism. So it's not hard to do. It just takes a little bit of testing, a little bit of knowledge.
We got someone else on Rumble asking, my blood pressure at my most recent visit was 124/70. Is that good?
It's wonderful. It's great. I mean, we love to see numbers like that.
There we go.
But also you want to see what your pulse is. I mean, you want to look at all the other parameters, but that's great for blood pressure.
There you go, sir. I've been on statins for 5 years now, and I'm starting to wonder, are there long-term risks with staying on it, or should I be checking anything else?
So I don't ever write for statins. I don't use them. I think because primarily they wipe out your CoQ10, that's a bad thing. The pathway that the statins work on is blocking an enzyme right before CoQ10 is made by your body, and then after that, cholesterol is made. So they're blocking it right before CoQ10, like HMG-CoA reductase. That's what statins affect. So the reason why people that take statins will have some muscle aches and pains and cramps all over, or one area or another, or they don't feel like they can do the exercise. CoQ10 is important for contraction of your muscle, and your heart's a muscle. So every patient that's been taking CoQ10, I recommend doing an echocardiogram, because that'll show us what your contraction, your ejection fraction, your left ventricle contraction numbers are, what the percentage is. And if that's dropped from your prior, then the statins are wiping out the CoQ10, maybe making your heart weak. Fact. So you can't take enough CoQ10 once or twice a day to compare the CoQ10 you would be normally making every second of the day without that statin blocking that pathway. So I'd rather people get off the statins. You use combinations of nutrients, berberine, red yeast rice, low-carb diet, exercise. So if we were to count the things that improve when you do a low-carb diet, exercise a half hour to 45 minutes every day, correct vitamins, minerals, hormones, they're multiple. So everybody should be doing these things, and then as they work, get off the statins and maybe get off the blood pressure meds once your weight's down and your pressure's good. So this is what we do compared to drug, some more drug, some more drug.
We have an Instagram question. What are your opinions on wearing an Aura ring or a Fitbit? Is it exposing the wearer to EMFs? I guess the signal problems.
But I like the idea of wearing something that'll tell you things that you could never know otherwise. So the Aura seems to be a great device. A lot of my patients and friends wear it. Fitbit, similarly, if you look at something that says, oh, you only walk 5,000 steps today, and you say, I got to make 6, 7, 8,000 or 10,000. Makes you do more exercise. That's brilliant. If it can look at, your heart rate, or some of them now, whether the watch or the ring will tell you how you're sleeping and you're getting interrupted. This is great. If you find these things happening, fix them, and your body will do better. I'm a big fan of that monitoring and that added psychological desire to beat the score that you had before. I want to do more steps. Or people will tell me, hey, look at my phone, or look at this. I did 20,000 steps. I'm doing this. Wonderful. It's genius. It's the smartest thing that people can do. Why not? Why not have more information, learn what your body's doing well, reinforce it, keep doing it, push for slightly better goals, if you like, and make sure that if things are abnormal within those markers, that you fix them. Great idea.
There we go. And there's a bit of a change up, but I just found out that I have endometriosis. Can stem cell therapy treat this? / have you treated this? And have you heard anything regarding
So endometriosis is a weird circumstance where the lining of the uterine tissue, is displaced outside the uterus and is stuck in different areas of the abdomen. Could be on the omentum, on other organs. STEM doesn't pull out and get rid of those clusters of cells. Typically, surgical procedures can do that. There are some doctors that might opt to change or use hormones, or sometimes hormone effectors or a blockade, to try to change some of those symptoms. But there's no vitamin and there's no mechanism for STEM to decrease the way that those cells react. So, sake of discussion, if in a week a woman is going to have her period, or 2 weeks, and the lining of the uterus starts to react normally to the hormone increase, you're going to feel it in these other areas because it's the same tissue, just not sitting inside the uterus where it's supposed to be. So some of the best results typically occur when they go in with laparoscopic procedure and remove those tissues from those areas.
Let's see what else.
Yeah, endometrial, and the mechanism there is not damaged or degenerated tissue, which is what STEM are attracted to create repair. So the surgical option is usually best for that.
All right. Throwing the phone number up there, 888-420-9272. We
Also,
are live.
We got to pop up the website.
Yeah.
So people could go take a look at the website, drcalapai.com. A lot of great videos, great information there. We're constantly adding new stuff to it. The email at the office, you can obviously email us through the website, and we're thankful for everybody who sends us lots of emails. So it's easy to go to the website, look at the videos, send us a question through there. And myself, my PA, we get back to you. We're just adding another PA, so we're pretty diligent with getting back to you. Even on my phone, I'll get an email if you email the website, and then that alerts me, it alerts the staff so that they can, and I can tell the staff, Mrs. So-and-so just emailed us. She has a question about this. Tell them that you spoke to me and I said that. So it becomes easy to give you some information right away.
And then our plant-based viewer has responded again. They said, my LDL is borderline high. Is cholesterol still the main thing to worry about, or are there other markers I should be watching? So
there are 50 things that I've found that increase your risk for plaque. It's not just total cholesterol, total triglyceride, low HDL, high LDL. There are subfractions of the LDL, the small, very small LDL, which are bad, large HDL, which is good, chylomicrons, apolipoprotein A and B, LP little a, homocysteine fibrinogen, C-reactive protein. Many viruses also correlate with plaques, so we test people for those. There's some great studies done on animals, and probably more studies have been done on animals and then gone to humans. But research many years ago was looking at animals that had died and looking at plaque in some of the animals. They found plaque in their coronaries. So that started to cut away some of the plaque, and they found that at the lining of the blood vessel, like you would see the plaque there, underneath the plaque, there were viruses, herpes virus, and other things that roughened the area of the blood vessel wall that maybe the plaque got stuck to when that plaque was cholesterol and all the other stuff floating around in your blood. So we know viruses correlate with plaque. Viruses are bad also, like Epstein-Barr's linked with MS, lupus, 24 cancers, Alzheimer's, Parkinson's, ataxia, all of these things. So the whole viral world, and Epstein-Barr is the most common virus in the history of mankind. 90% of the world has been exposed to Epstein-Barr between kindergarten and college. And if that's a virus that we put a little bit more understanding or effort into, we realize it's really bad because it's somewhat hidden. Yeah, if you have mono, that's a full-blown active early infection when you're a kid, but that bug can come back at any time, and you may not feel that you're stuck at home and bedridden. You may have to feel tired, achy, irritable brain. We find it, and we use nutrient recommendations to help to inhibit it. So there are lots of things that correlate with plaque in your blood vessels that we test for. So we're looking at how to put all of those individual risk factors into the best range. You want to tighten that LDL. So plant-based diet, vegetarians and vegans typically might have a lot more carb than individuals that are not. So sometimes too much carbohydrate from bread, pasta, potatoes, fruit, oatmeal, grains, etc. will keep the cholesterol and the LDL and, of course, triglycerides higher. That's why we scrutinize diet with everybody and give them some guidance.
All right, we got one more over here. Is there a difference between arterial plaque and calcification, and is there anything we can actually do to reverse either one?
So arterial plaque is just plaque within an artery. There are veins and there are arteries. We did an interesting article here, it was on my desk a week or so ago, talking about that there are different types of plaque. So if the plaque is early and it's just soft, non-calcified plaque, it may be easier for that to dissolve or to change with low-carb diet, exercise. We also do intravenous therapies, calcium EDTA chelation, phosphatidylcholine recommendations. If plaque is calcified and it's hardened, that's more difficult because it's like having cement on top of it. And the third more worrisome issue is that sometimes plaque can get ulcerated. And you know what ulcers look like on someone who's got diabetic skin ulcers, it's a crater. If plaque is not smooth and soft and starts to get irregular, then as the blood pumps by it, sometimes just that bulkhead of pressure from the blood can start to break off pieces of plaque, which would be super bad. Can lead to heart attack and stroke and clogging of vessels. That's why we do the sonograms, to be able to look at, the plaque mechanism. Look at your neck, your heart, your legs, abdomen, vessels, etc.
All right, let me see what we got here. All right, the chat has relaxed a bit.
Okay, can take a little breather.
Have a sip of
Once
coffee.
again, the website, drcalapai.com. Garden City office, 516-794-0404. The email through the website is ccmedical503@yahoo.com, but you can just go to the website for that.
And I'm including that in the chat. You could all
Perfect.
see it.
Lots of good stuff comes from knowledge and learning.
People are saying
The more
they're,
you learn.
they're excited for you to roll these devices out. So
Yeah, I'm totally stoked. I saw pictures of some of these things. The watch looks super cool. It's like an Apple Watch. And I'm a gadget person. I mean, I love technology. I love all these little gadgety things. I was just telling you before that, I like dressing up and sort of old school when I used to work in clothing stores before I got into medical school, wearing nice jackets and pocket squares. I just got a bunch of pocket squares, and they make this cool device. It's a little plastic device. It's black, but it's got some slits in it. So you put your pocket square in there, you perfect it, and you pop it in your pocket. It's genius. It's like $2. So some genius made this thing, is going to make $100 million, because now you can just put your pocket square. It stays in there perfectly. It doesn't move. You could, leave the tips of the pocket square up. You could put a little straight look on and they come in. I like Paisley. Paisley's my favorite design for pocket squares. But yeah,
Someone's sitting on a pile of money with that
idea. God. I wish I would have thought of it. A lot of stuff I wish I would have thought of it, but someone else came up with it first. But yeah, I love gadgets. I love the watches. I love, the computerization, the ability to gather information in seconds about anything and anywhere. Yeah, all of that. So in my mind, most of medicine is going to become this well-done, comprehensive telemedicine mechanism. Because if you look at the number of people coming in for dire circumstances to doctors' offices, it's not as much as the people who could just as easily talk to you from their home, even video chat with you from your home. They have a rash they want to show you. So most of what people present to doctors typically can be done through telemedicine, and because we can send the lab and then we could use the remote patient monitoring, we've got tons of information. If it takes you 3 months to see your doctor, what's going on between those 3 months? If we have a way of gathering info on you, we track it. What's better than that? Yes, if you have something horrible and you need to be examined by the doctor, yeah, and you still should go in periodically for your exams. I'm not saying that you shouldn't do that. You should definitely do that a couple times a year. But if most of what people go through, fatigue, aches and pains, sinus infections, allergy, all the things that people, present with, so much of that can be dealt with within this mechanism. And better once we have the monitoring mechanism on board. So every doctor gets a call from a patient who's just in some sort of distress and having that big problem. And they've got to get them to the ER, and et cetera, et cetera. I don't want them to get to that big problem. I want to do all the natural stuff, the vitamins, all the great stuff that we do, so that people don't get to that spot. I want people to be able to bring the weight down. We can talk to people about low carb and exercise, et cetera. Some people opt to do the weekly injectables, the GLPs. You can do that. We teach people how to do that at home. But I want to track, and we can track that, yeah, you're losing the weight, and repeat your blood test. Wow, your sugar's down, your cholesterol's down, your pressure's great. What could be smarter than that?
I think it's genius, and I'm excited to roll it out.
Yep. We're going to talk about it every program. We're going to put it on News 12 and all the TV things that we do. And it's exciting because it creates a whole new realm of monitoring and caring for and connecting to the patient. Luckily, working over the years with different PA schools where the students would come in and shadow me, and I'd show them all sorts of cool stuff. And I've had some great PA students and great medical students as well from my medical school. The PA students are so eager and excited to learn and do. And, their enthusiasm is terrific. Medical students, they're bombarded with, oh my God, am I going to get through this? And, you're a little frantic when you're in medical school and you're doing your rotation because you have so many different things on your mind. And the enthusiasm's there, but in discussing this, with the staff, and my staff just loves the idea, of course. I mean, there's nobody who wouldn't like the idea. It's going to be exciting to be able to do this and be able to get this worked out for a wide range of different patients. So,
yeah, we've been seeing it. It's, Sabrina's sister's at your medical school.
Yeah.
And it's like, if we even get to see her, they're just
it's rough.
30 places. It's
No matter how
insane.
smart you are. We had one of my buddies from medical school, Bob Rosen, became a dermatologist. He had a photographic memory, and he was a genius, beyond genius. He would go to class, and after class, we'd sit around and talk about stuff and ask each other questions. And he would say, well, yeah, it's this, it's that, da-da-da-da. You want me to explain it to you? But it's just, he just knew everything. He was talented at sculpture, at painting, and there are some funny stories which I'll have to figure out if I want to be able to tell everybody at some point. But we used to have study classes at, the end of the day, and he was the guy to ask the questions, to, because he just knew it. I think he breezed through medical school. He was without a doubt one of the smartest people I've ever seen. Never had a difficulty with anything, and he got perfect scores on all his grades. But, there's some people that just breeze through it. It's very, very few. But the amount of reading and work and knowledge, and you have to study in groups because someone might know something you don't, and you may be able to help them. So we studied in groups all the time. We also did something really smart that we'd study for 2 hours and then take a break. We'd run, throw a football around, kick a soccer ball, do whatever for a half hour, then go back to it for 2 hours, and then take another break. So we would do 2-hour study sessions where you're not doing 5 or 6 hours in a row because you're burnt out and now you're not remembering anything after 4 or 5 hours, but 2-hour sessions and then exercise. So that worked really well for us.
It's been a while.
Yeah. There are always better ways to do things, and that's why in my mind I'm always trying to figure out what's the best way to get this result or this outcome. So, and that goes a long way in medicine as well. There are some people who don't want to change their diet. There are some people who don't want to take vitamins. There's some, and to be a good doctor, you have to be effective. You have to be a coach, a counselor maybe, a detective, but you have to try to get that end result in there. Some people love to go to the gym. Some people won't go to the gym. And if you can start by adjusting their diet a little bit, get them a B12 shot, get them, because they'll never give up their morning coffee, I think, to put a little plant-based protein powder in the coffee. I use Orgain, which is great. And that's a great breakfast. I take my vitamins with that. If you get people to start that and say, wow, I feel better than having the bagels or the cereal. Their bloating's not there. You've got them. Once they start to say, wow, the bloating's gone away, I feel better, more energetic, and I put a little collagen peptides powder in there. But once a little bit starts to happen, and now their B12 levels are better, they have more energy. If the NAD levels are improving because of what we're giving them, they start to do the exercise, they feel great, they don't stop to do the exercise. And all of a sudden, someone's doing 45 minutes every day, their weight's down, and the whole avalanche of benefits occurs because some people you have to start very slowly and gradually work them into it. So, okay, we're down at the end of the program, I believe. Thank you so much for your questions.
Got the website up
All
there
the info,
for you.
Website's there, drcalapai.com. Phone number to the office, 516-794-0404. We'll be back here tomorrow at 2:30. We love to hear from you. We love to take your calls. And we'll be presenting more great information day to day, 3 days a week. Monday, Friday, 12:30, and Saturday, 2:30. God bless you all. Have a great